Simon Hagens, I lead the performance team at InfoWay, so you'll get a bit of an infomercial about what we do, but hopefully I'll share with you a bit of context about the digital health landscape and where we're at in it, and where we need to be, and there's a pretty big gap there. So that's a lot of the story I'm here to tell. So I'm going to start with the end in mind, which is the vision of what we're shooting for. This is a vision, so I've been in this industry for over 20 years now, and this has been a vision presented in different graphics and different forms, but the same basic concept for my entire career. So it's the idea that care should be connected, that patients should be at the center of their care journey, that their information should follow them when they cross care settings, that their care providers should have access to great data to be able to inform their care, their treatment, that their caregivers should have access to the information that they should have. Researchers and many other actors in the health system that need to manage the health system, drive innovation, should also be able to make appropriate use of that data. So this is the vision that we've had for a very long time. We just happen to be a very long way from that vision. And it is an increasingly urgent topic. So this is the context that I think for folks in this room that have been working in this space clearly for a while, you're very familiar with. But I'll restate it because it's pretty important to remember where we're at. The stats on the left-hand side are from the shared health priorities. So these are federal indicators looking at some of those top health priorities. And on the right-hand side are some statistics from our clinician surveys that we conducted InfoWay. So what we know from the shared health priority indicators, not at all a surprise. We have massive capacity and access issues in primary care, in acute care, mental health services. There's not enough capacity to go around to meet the need of Canadians. And we also know the flip side of that coin is our clinicians are burnt out at rates that we've not seen before. So unprecedented challenges. These are really important challenges to keep in the forefront of our mind for a couple of reasons. The first reason is that if we've got projects ongoing that are not solving these problems, then we might as well set them aside and work on ones that are, because these are the issues that our health systems are facing today, and we need to make sure we're marshaling resources towards solving them. The other important thing is that this is the context in which we're trying to deliver solutions. So we're out there talking about digital health, talking about we've got a great shiny new tool that's going to make your life a whole lot easier, doctor or nurse. And they're saying, I don't have time for that conversation because I'm knee-deep in paperwork that I should have done, in patients that I should have seen. So we need to recognize that we're trying to deliver change in a system that is really struggling right now. These are some stories about digital health over the last couple of decades that I think are pretty important to our understanding of where we're at and where we're going. They're from the Commonwealth Fund survey. So the Commonwealth Fund is an American organization that does surveys of 11 different countries. They survey citizens, they survey older adults, and they survey primary care providers on a rolling basis. And so they provide this great longitudinal data set about where we are as a country, but really importantly, where some of our peer countries are and how we compare to that. That top left graph is a really inspirational graph. That is electronic record keeping. And what you'll note, so I started my career before the dot-com bubble, implementing an EMR and in a community health center in Hamilton. And at that time, I was wandering around looking for clinics in Hamilton that had functioning electronic medical record systems. There was a few of them. They were pioneers. Less than 10% of the country was using electronic medical records at that time. But as you can see, much of the world was already fairly digital, right? We had large chunks of Europe, many advanced countries already pretty heavily implemented with electronic records. Significant effort into the 2000s, 2010s for us to close that gap. And this was a big area of InfoWay investment back starting in around 2009 and going through about 2015. And I actually didn't think we were going to close that gap. I thought that we would catch up to some extent, but that we would always lag. But look at that. In this last survey from last year, we are now at the international average, 93%. So we have a healthcare system which now is largely digital. Most of the record keeping that is happening is now happening in a computer. The other three graphs are the flip side to that story, and that is that we have not caught up on connectivity. So if we talk about, can you exchange lab results? Can you exchange patient summaries, medications? We have made some gains, moderate gains. We're still in the 50 or below range there. Our international peers have also made modest gains over that time, but we have not made any progress in closing that gap. So we have a challenge on our hands. These are a couple of slides from a study that we conducted earlier this year, where we went province to province and we talked to vendors of digital health solutions across the country, and we asked them what standards were in place. This is just one of those slides. The full report is on our website. Actually, the link's been cut off there, but if you go to our website, and I'll give a little plug for our Insights website that we host at Canada Health InfoWay, lots of data on there, and this report is one of them. So the big takeaway from this is whatever domain of information you're talking about, if you walk across the country and say, hey, what standards are you using to capture this kind of information, you're going to get a whole bunch of different answers. 3 or 4, 5 or 6, 10 different types of standards. And what you'll note is that many of these standards are pretty old. Many of them predate my time in the digital health sector. And so we are clearly working on a foundation which is out of date and quite fragmented. And the same thing with exchange standards. So where we are exchanging information, are we exchanging it? What standards underlie that data exchange? We see HL7v2 and DICOM reasonably well deployed. Those have actually go back to a lot of the early InfoWay investments in provincial electronic record repositories. And so it's largely things like lab results, diagnostic imaging reports that are being shared around in those standards. Then when you get further down the list, you've got a lot of different newer standards. FHIR, I distinctly remember kind of 2015, 2016, the world's on fire. And so FHIR does show up on that list, but it's not in the plus 50% range. So we have an environment where we are not exchanging information, and it's no surprise, it's because our systems don't talk to each other. We know if we give clinicians better interoperable tools, if they can communicate more effectively, they anticipate it's going to be a much better environment for them. They talk about better patient care, safer patient care, patient experience, time savings. And levels of agreement in the high 80s, 90% range with the technology are not that common. So what this tells us is that clinicians really, really want to see this problem solved. So, do we have a magic wand to solve this problem? We've been challenged with this same issue for over 20 years. And we often are excited about the notion that a new technology is going to come along and save us. And that's my daughter waving not a magic wand, but a sparkler. And so I hope she's going to hit something. So I wanted to get a sense of, and this was a little thought exercise I did, a sense of where transformative technologies have taken us over these past 20 years. And so with a bit of help from ChatGPT, I asked ChatGPT to generate a list of the top technology buzzwords or transformative technologies each year since 2000. I had to ask a couple of times and rephrase a tiny little bit, but it actually spit out what I thought was a pretty good list. So having worked in this industry over this time period, this brings back a lot of good feelings, memories of great buzzwords past. And many of these technologies still have a lot of promise and a lot of really important things on this list. So electronic health records, what we were talking about 20 years ago. We were talking about PACS systems, about e-prescribing. Telemedicine, as you get into the 2010s, you start to see more on analytics, big data. 2014, initial talk of AI in the context of diagnostics. And then, of course, more AI in recent years topping that chart. Telemedicine, virtualization of care, of course, very, very important in the pandemic. The right-hand side of this graph, which was supposed to pop up as a big reveal so you can go, woo, but right-hand side of the graph is where are these technologies today? So we have a fair amount of data at InfoWay. We survey clinicians, Canadians, on a routine basis, and have a variety of data sources to try and understand what's the current state of deployment of these technologies. And I'm sure that there would be different opinions in the room about where some of these arrows might fit, but the gist is, some of those ones from 20 years ago are now pretty broadly deployed. Electronic health records, as I was just noting, are broadly deployed. We have most clinical settings are now charting electronically. CPOE and electronic prescribing, lots of progress. PACS, God bless PACS, we've made a lot of progress there. And then as you get into the sort of late 2000s, things like telemedicine and analytics, we see as reasonably mature. Anything from the last 10 years, though, all those buzzwords are still quite small portions of the actual healthcare delivery. Now, that doesn't mean they're not out there being used in interesting ways, but do they impact the majority of healthcare interactions? And the answer for many of those is no. So we have a real challenge in Canada with diffusing technology, great innovations, through our health system so they actually add value to patients. And what we see from this graph is 20 years is kind of the time frame. We like to talk optimistically about a 10-year cycle, but when I started putting these arrows on here, I had to admit that it's probably closer to 20. So what has held us back? And that's a pretty long list of things. And I think many of you could probably come up with a bunch of items that you would add to the list. But these are the things that came to mind for me. Is there enough money being put into to this system? And is it being put in the right place? Do our payment models in the healthcare system encourage uptake of technology? Do our procurement processes encourage uptake of technology? Do we have clear regulation and legislation? Do we have standards in place? Do we take care of the liability issues so that clinicians aren't faced with dealing with the liability issue for new technology themselves? Do we have great evidence that supports these? Do we have great clinical input? Have we addressed privacy concerns? Do we have mandates that are actually long enough to achieve these things? So I think we can see from this that lots of these amazing technologies that I still believe in, and many of you I know still believe in, have been held back by these challenges. And I put these challenges into three buckets. We've got a bucket that's about money. How do we fund things? Are we funding them sufficiently? We've got a bucket that's about rules. Do we have clear rules? Are they rules that enable the use of data, that encourage us to use new innovation and to use data effectively? And do we have the supports and the moral suasion to help our clinicians, to help patients actually use these tools? And I would argue that the success we had in actually closing the gap on electronic health records over the last 20 years was actually the convergence of us getting those three things right. Us being able to put money where it needed to go, us being able to really work on sorting out the rules environment so that the legislation was sufficient that allowed clinicians to feel comfortable adopting, that people understood that they could buy these things and use them without fear of risk, and that allowed us to actually implement those solutions. And then we needed a ton of support to help clinicians implement those tools effectively. A surprising amount of support. And I think we forget the amount of effort that went into the adoption of electronic medical records in community care was actually based on armies of peer networks, change agents that were going practice to practice, helping people to implement, assessing where's your practice at, what tools do you need to implement. So we kind of forget the amount of effort that it actually takes to bring people on board. So my argument is that if we can get those three things right, as policymakers, as leaders in this space, we can really move mountains. But if we forget one or two of these, which we frequently do, then we're going to get stuck in the mud like most of those technologies that I described were. So I'm going to try to get back to the slightly more inspirational view of the talk, which is that I actually think we're in a better position today than we have been for a long time in terms of the raw ingredients to close that gap on connecting care. So I loved in the initial session, Victoria talked a lot about some of the amazing analytics work that happened during the pandemic. And the pandemic was a fascinating time period in that we saw the best of digital health come out. We saw analytics professionals solving problems in completely creative ways. We saw electronic medical records all of a sudden vitally important because doctors were at home trying to deliver care to patients who are also at home. We saw telemedicine, virtual care come into practice in a way that it had never been adopted quickly and seamlessly, and many metrics would suggest that Canada did a whole lot better than other places. But we also found that the lack of connectivity was a massive problem during the pandemic, and we found that there was a great many questions that we needed to answer that we simply didn't have the data or the mechanisms to do so. And so that created a bit of a foundation for change. Maureen made reference to the Pan-Canadian Health Data Strategy. That's the document on the left. If you're not familiar with that, it's a really important document. And it really states the case for needing to have great data, not only to inform care with the person that's sitting in front of that clinician, but to inform the system. And it builds a case that we need to get both right and that they should work in tandem. That case was followed up by the federal government making investments in my organization, Canada Health InfoWay, and in CIHI to try and advance that work and publishing the Pan-Canadian Health Data Charter. The other important publication in that time frame is Interoperability Saves Lives, and I'll talk a little bit about that at the end. So what does that work look like on the ground? So our organization, InfoWay, and CIHI are working very closely together to try and put in place some of those rules pieces. What are the content data standards that should be the underpinnings of health data? What are the data exchange standards that we should be using to share data seamlessly? What are some of the trust requirements that should accompany that sharing of data? And then the really important piece of the rules environment is enabling legislation. And we know that we have a patchwork of legislation that relates to health data use in Canada, and that it is not serving us well. And it's, as was noted up here on the stage, it's not necessarily the legislation itself, it's often the interpretation of the legislation. But regardless, we have a situation where that legislation is not allowing us to do the things we need to do. Bill C-72 is a big leap forward in that respect. It's a bill that's been tabled. It's not yet been voted on, but we're optimistic that this is a big step in the right direction. We're also very optimistic that every party in Canada has the same interest in a good Canadian healthcare system, and we've had no sense from any parties that this is not something that aligns with their interests. So our hope is that eventually we can get this through the Canadian healthcare system and get to the point that we have legislation that underpins the work we need to do. So let me tell you a little bit about our roadmap. The Pan-Canadian Interoperability Roadmap is really focused on core objectives. So there's been lots of great discussion today thus far about the fact that results are what really matter. We can talk about data all we want, but at the end of the day, what are we delivering that's valuable to the healthcare system? And so we're really talking about delivering 4 things. First is data portability and data blocking, a recognition that primary care is where vast majority of care is delivered in this country, and the vast majority of the data associated with all those primary care visits is inaccessible to anybody. And much of it is poorly structured. Being able to access that data is an underpinning to being able to do a whole lot of different things. We recognize that providers, when they're providing care, they need the best data about that patient from wherever in the health system that patient has been. And that data needs to be at their fingertips. And it shouldn't take them half an hour to go and find it. Because that's how much time clinicians tell us they spend a day looking for information that should be in their system. It's half an hour. We want patients to have access to their information and their caregivers. And they should have access to all of their information, and they should have access to it at the same time as their care providers. So they are really at the center of that care circle. And then finally, care coordination and collaboration. That's being able to share information back and forth seamlessly and appropriately, and it's being able to communicate effectively with other clinicians in the circle of care, even if they reside in a different organization. So those are the objectives of the roadmap, and they are built on a set of building blocks, which are things like directories, standards, legislation, trust framework. All of those are pieces that our organization, CIHI, and provinces and territories across the country are collaborating to try and put in place so that we're in a position to actually deliver on this roadmap. So this is a very ambitious process, and as I noted, have described it many times as a 10-year process, and maybe we should be describing it as a 20-year process, but there's a lot of patience, effort, persistence that will be required to get this done. With that in mind, measurement along the way is really important. And so these are two mechanisms by which we will be measuring. The right-hand side is a shared health priority indicator. So the federal government has a set of shared health priority indicators that really relate to what are the big challenges in the healthcare system. There are now, I think, 4 that are focused on digital health in various ways. This is one of them. It's Canadians that have actually accessed their health information. As our collective mandate to deliver interoperability advances, those shared health indicators around digital health should improve. And ideally, they are dragging with them indicators that relate to other aspects of the healthcare system, specifically capacity and access to care. So that on the right-hand side is going to be your macro indicators, and you're going to go to the CIHI website to follow that over time. The left-hand side is the maturity dashboard for the interoperability roadmap. And this is for the nerds. So this is where you can go and dive in and see where we are at on various aspects of that delivery. And we've tried to make this really granular because at the end of the day, it's about a whole bunch of little pieces coming together and adding up to the greater sum. So you might note that measurement framework on the left is built around a logic model. Basically says you need to make standards available. They need to be embedded into the products that are on clinicians' desktops. So vendors need to implement those standards. They need to deploy those standards-based solutions to clinician desktops, and then clinicians actually need to use them and use them effectively. If we don't get that causal chain, we don't get to the outcomes we're talking about. So that measurement framework is built into the logic model and is intended to measure that. It's actually got filters that allow you to look at province by province where we have provincial data, and we'll be updating this on a rolling basis. We're putting in there new data all the time. And that's available at InfoWay Insights website. So if you Google InfoWay Insights, you'll find our Insights website. The maturity dashboard is one of those things. We also present there a whole lot of our clinician survey data, citizen survey data, and a variety of other research reports we've done. So I want to end by going back to interoperability saves lives, because this, I think, has actually been a really important part of the journey. The fellow on the right is Greg Price. Greg Price lost his life in part due to miscommunication and faxes, missed appointments, appointments that should have been made and were missed. And over the passage of time, Greg's condition became unmanageable, and we lost him. His family has been an incredible advocate for change in healthcare. They're in the agri-food business. His father very poignantly said, this kind of mess would never be acceptable in the agri-food business. They would come to your farm and they would shut you down if you had the data holdings that the healthcare system has. So they've demanded better. The Interoperability Saves Lives report makes a really important point about managing and balancing risk. And as we've heard a couple of times on the stage here, the risk that has always been in the forefront of people's minds in healthcare has been privacy risk. It's that risk of exposing a person's data. And that is a very, very important risk for us to understand and manage. Canadians care deeply about the privacy of their healthcare data. The flip side of that risk, however, is patient safety. And it is lives lost. And the fact that we have not accounted for these two things in the same way over the years is the central thesis of Interoperability Saves Lives. And what it suggests is that we need to look at risk differently. We need to assign risk to not sharing data the same way we assign risk to sharing data. And if we change that paradigm, we can start thinking about things differently. So that's my story, and I've got 5 minutes left to take questions, and I would love to be challenged or nudged about anything I've said. Thank you.
Hi, I love the presentation, great information. The one thing that I'm starting to wonder, and I'm seeing it more from an analysis side, is the importance of being proactive in health. And some of the pieces of our healthcare system don't incorporate things like naturopath, homeopath, acupuncture, like non-Western traditional things. Is there something built into this interoperability plan for that potential opportunity to include it?
Absolutely, yeah. And so I think one of the standard Achilles heels of digital health projects is that they start with a physician and they trickle down from there. And that is a challenging shift to make, but we've tried to ensure that the roadmap is really inclusive of a broad set of health professionals. Now, the important thing is that the health professionals of varying stripes should raise their hands, come to the table, and be vocal about it, because it's very easy for those voices to get drowned out. So I would absolutely encourage participation in standards development working groups, participations in committees, getting involved at the provincial level, because I think that contribution of those voices and saying, hey, we're here, we need that data, and here's why, is really important. I've been surprised at the number of clinician surveys we've done. Many nurses, in fact, saying, yeah, I don't have access to these records because it was not deemed as something that was important for me to have. And pharmacists, similar challenges. And so there are a wide variety of health professionals that need to be further in the tent. We're working towards it. We're not perfect by any stretch.
Hi, thank you so much for the presentation. Really interesting stuff. My name's Dom. I work for a think tank called secondstreet.org. We talk a lot at our organization about patients traveling for healthcare. With the state of the system and wait lists as they are, you really don't have any other option but to travel if you don't want to sit there and wait on a government wait list. Yeah. What kind of challenges come up and what kind of solutions are there for people who go to Lithuania and get a hip surgery and come back? And, oftentimes at private facilities over there as well, communicating about that patient's health and what they need moving forward when they've gotten care in another country.
Yeah. Great question. And millions of challenges, right? And I'm sure nobody would be surprised. That's a scenario which is really hard to manage. For me, one of the most inspirational things has been increasing patient access to their own information. Because often the most effective way for that information to travel is through that patient. So if you're that patient that's going overseas and you have access to an electronic health record, you are able to actually pull that up and share that information. And ideally, you can bring it back. The other use case that I think is worth taking a look at is the International Patient Summary. So Canada is involved in the International Patient Summary. This is, as noted, an international standard, and the idea is having a common way to reflect core elements of a person's health history. And the idea of it being international is that if it's a standard that can be implemented in many of the multinational vendors that are out there, we start to improve that kind of portability. One of the use cases recently was the Hajj and the trip to Mecca, and the International Patient Summary as a use case for how folks making that journey could carry with them a copy of their patient summary, so that it could be used. And I think that was a very small use case, but the sense is we'll be looking for more and more of those international use cases. And Canada is part of the Global Digital Health Partnership, and this topic is a routine one at that forum. I think there's one there and then there. Sorry, I'm again looking to the left, but I will look over in this direction as well.
Thanks very much. I'm really interested in the person access to their own health information piece as well. I guess part of what we say about access requires literacy, right? Because putting a bunch of technical stuff in front of somebody is not always going to be helpful. So what additional steps or parameters need to be thought about for the literacy aspect of access?
Yeah, great question. So I think we're getting really good at measuring literacy, and so we've measured health literacy and digital health literacy on surveys for a while now, and it's actually now one of the shared health priority indicators. I don't know if we're doing much about literacy, so that line has been very flat. Yeah, exactly. So I'm afraid that's the answer. We now know that literacy is flat. And so the ball, I toss the ball to all of you to try and help raise that. It's a big challenge. We need to help people understand how to use their health data. Do you want to go next?
Forever, primary healthcare data has been a black hole. And I think we're all realizing, especially in Ontario, as we're starting to integrate carers through OHTs and understanding that they're the hub or need to become the hub for care delivery. I'm just wondering, based on the work that Canada Health InfoWay has done, are there particular challenges on your roadmap and in terms of interoperability, like knowing that there's 5,000 primary care EMRs, they've all been allowed to set up things in a different way that goes to the back end that is not the same. I know when I tried to access data, it's like something as easy as, did you smoke? Could be in 3 to 5 different places. So I'm just wondering if you can speak to whether or not there's particular work or particular challenges that Canada Health InfoWay has recognized around how to do this in the primary care setting.
Absolutely, yeah. So primary care is the substantive focus of this work. So reflecting that the hospital sector is not perfect, but way better off in terms of number of vendors, ability to share information, common standards, things like that. So primary care is the focus. And the major game plan is to develop a set of standards and support vendors to implement them and deploy them. So it really is getting back to basics. It really is understanding that there are different data models out there, and those are going to have to adjust to a world where they're going to need to be able to structure data in a patient summary or an e-referral and e-consult that is consistent with the same patient summary and e-referral and e-consult that is going to be produced by the EMR vendor next door. And that's a big part of what Bill C-72 is about saying, okay, we can't have a million different kinds of data models and different systems out there.
I'll give you some analytics to support your practice, right? Whether that be through physician, like you can benchmark against your peers, or just even understanding population health management, like those sorts of things. So does it extend beyond just the patient-facing piece of that, so that, you know, it's easy for, again, I'm just thinking about, I mean, I'm coming from the hospital sector, but in all reality, our organization is probably going to be the only one that will have the infrastructure to be able to support that analytics from a population health management perspective. The idea, I have 500 primary care physicians in my catchment area. The idea of trying to map that for everybody is not, I'll be retired before I'm able to, so I'm just like, does it front end, back end?
Short answer, not really. Like, and so that's not, I would say that is a massive challenge, but it's not a challenge that's part of our mandate. But, you know, being involved heavily in the community health center sector for a number of years, that idea of like, you know, you can have a good sized organization. Can that organization afford to have a robust, well-skilled, well-paid analytics department? No. So we got a big problem there. Yeah. I'm sorry, I think I'm already over time. All right, sorry. Okay, go ahead. Can we do one last question?
Just out of curiosity, there is that European health data space where they're really trying to do this across the physical national jurisdictional borders.
Yeah.
What do you think it takes for Canada to catch up to the EU, especially Canadian health system is like the EU? Yeah.
So that's a great question, and I wish I had a great answer, because I do think we do need to catch up. But the European health data space is built on GDPR and a fundamentally different way of looking at citizen rights and citizen access to data, and is a legislative framework which goes a lot beyond what we're currently thinking of today. So I would encourage everybody to have a look at it, but I wouldn't expect we'll see it in Canada in the very near future. But I really appreciate that reference. Thanks, folks. So we're going to switch around and get the panel up here.